So why is pain control important in burn patient? As we all know, burns are among the most painful of the injuries and they cause intense and prolonged pain, and obviously for the well-being and comfort of the patient, pain control is very important. But let us see the scientific reasons behind management of pain in these patients. So first is prevention of autonomic instability. So severe pain can trigger a stress response leading to autonomic instability, which can manifest as increased heart rate, increased blood pressure and metabolic demands. So this stress can be particularly dangerous in burn patients who is already at risk for these complications like shock and multi-organ failure. So when we do adequate pain control, it helps stabilize the autonomic nervous system, thereby reducing these risks. In addition, when we do a proper pain management, it allows the patient to tolerate the necessary procedures like wound debridement, wound cleaning, dressing changes, and physiotherapy. So when these things are taken care of, there is early sort of improvement in the wound and early rehab of the patient. When we manage acute pain very effectively, then it leads to less chances of that pain going into a chronic pain. So persistent pain can become a significant long-term problem for burn survivors if acute pain is not addressed aggressively and effectively. Then another important point is psychological and emotional well-being. So severe and unrelieved pain can lead to psychological distress, which includes anxiety, depression, and post-traumatic stress disorder. So effective management of pain reduces chances of all these things. In addition, if the patient has specific pain in the chest or abdomen, it can restrict deep breathing and coughing of the patient. So when this is reduced, as we all know, it can lead to atelectasis, collapse of lung, pneumonia. So effective pain control also allows the patients to breathe deeply and cough effectively, thereby reducing the risk of all these respiratory complications. It also promotes early mobilization, which we have already discussed in terms of physiotherapy. So early mobilization means there are less chances of muscle wasting, there are less chances of joint contractures, and there are less chances of deep vein thrombosis as well. So because of all these reasons, it is very important for us to ensure that there is effective pain management. One of the important points which I missed is the enhancement of sleep and recovery as well. So pain can severely disrupt sleep, which is vital for healing and recovery. So poor sleep can also impair the immune responses. That is also one of the reasons why we should effectively control pain in all the burn patients.